Okay, well, hi everyone, and a very warm welcome to you all in our first InnoScot webinar of 2024, collectively realising the ambition to make Scotland one of the most innovative small nations in the world. It's an ambitious title, an ambitious topic, and quite rightly so for all of us working in the health innovation ecosystem. My name is Leah Mayer. I'm the Innovation Manager for North Scotland and the Islands. Robert can't manage today, but we're going to have Jane helping with questions at the end. So why look at Scotland's innovation scene in this really broad capacity today? Well, we thought that with the start of the year, it would be a really good opportunity to look at innovation at a macro level. So we're really delighted that Richard Lochhead, MSP and Minister for Small Business, Innovation, Tourism and Trade, has taken some time out of his very busy diary to record our introduction today. He's going to be focusing on the Scottish Government National Innovation Strategy 2023 to 2033. I really recommend, I'll put the link in actually at some point in the chat for the strategy, but I recommend that you do look through that at some point because it underpins the innovation strategy in Scotland really well, including in life sciences. Then I'm really excited to be introducing Carrie Thomson, who's with us today. She's got dual role for the Chief Scientist Office Programme Lead for Innovation and Collaboration, and also the Digital Lifelines Lead with Digital Health and Care Innovation Centre, DHI. And she's going to be looking at national level and exploring what's happening within the Chief Scientist Office, how innovation is embedded into NHS Scotland, and exploring some specific examples of some current programmes. If you do have any questions for Carrie, please pop them in the Q&A box and someone will be collating them and they can be answered at the end. If you have any specific questions for the Minister, you can pop them in the Q&A as well, along with your details, and we can direct them to his office, or you can email InnoScot directly with those questions and we can direct them that way. So without further ado, I will introduce Richard Lochhead, who's going to start our introduction today.
Good morning, everyone, and thank you to Robert and Lee for inviting me to speak at today's webinar. The theme of today's event is collectively realising the ambition to make Scotland one of the most innovative small nations in the world. So it's my opportunity today to highlight the great ambitions of our National Innovation Strategy, which we published last summer, and the role that we all have to ensure it's successful. Following on from that, you will be joined by Carrie Thomson, Programme Lead for Innovation and Collaboration in the Chief Scientist's Office, and she's also Digital Lifelines Scotland Portfolio Lead within the Digital Health and Care Innovation Centre. And she'll give an overview of some of the really incredible innovative projects being delivered by the Chief Scientist's Office. Now, I firmly believe that we can only achieve greater innovation through greater collaboration. So by working together, we can get the most out of Scotland's diverse innovation ecosystem, becoming truly more than the sum of our parts, which is something that I also want us all to achieve. And in that spirit, Scotland's strategy was designed and developed alongside industry experts, entrepreneurs, business leaders, and academics who all came together with a shared vision to once again make Scotland one of the world's most innovative small nations and ensure that happens over the next decade. I'm sure Scotland's rich history of innovation will be known to everyone here today, but I think it's worth reflecting on how remarkable it truly is. The health breakthroughs, for instance, we now take for granted, from general anaesthetic and the hypodermic syringe to the MRI scanner, were all Scottish innovations. And Scotland today is still continuing its fine tradition in pushing the envelope when it comes to innovation. Scotland's innovators continue to identify and solve global problems, whether that's in health or energy or manufacturing or engineering or creative and digital technologies, or a range of other sectors and industries. That's why when I say that Scotland can be one of the most innovative small nations in the world, it's not hyperbole, but simply hopefully taking our rightful place in the 21st century, as we have done in the past. I have no doubt that our great innovation community will rise to the profound challenges and changes that our increasingly interconnected world presents over the next 10 years. That's why the time is right to publish a national innovation strategy and why innovation is a crucial priority of the Scottish Government. And also why I'm really excited to be talking to you all here today so we can build in the past but embrace the present and look to a sustainable and innovative future. And the future of innovation in Scotland depends upon sustained focus on these areas where we can truly lead the world. That's why we have chosen to focus on 4 key priority areas throughout the strategy: advanced manufacturing, energy transition, data and digital technologies, and of course, health and life sciences. These areas are already pillars of Scotland's economy and areas of existing strength. We already have the educational, industrial and natural assets that are necessary to be truly world class and to grow clusters of successful businesses in the markets of the future. The strategy sets out the actions that we will take to support the scaling of our innovation potential within each of our priority innovation areas through 4 transformational programmes focused on cluster building, investment, commercialisation and productivity. We will develop an approach consisting of tailored public support packages which will catalyse growth and stimulate further private sector investment to support these priority clusters to achieve their potential. We will adopt an investor mindset to support our most innovative businesses, investing where we have a competitive advantage and leveraging in venture capital and providing a comprehensive, coordinated and decluttered package of financial backing. We will transform our commercialisation landscape, strengthening the role that our research base plays in driving economic and societal prosperity. We will support even more of our businesses to become innovation active, and we will introduce an innovation themed national productivity programme as well. To ensure we are making the necessary progress towards achieving our vision through these 4 transformational programmes, we will track our innovation performance on a number of key metrics that we're going to introduce over the next 10 years as well. I'll leave you today by restating the vision of the innovation strategy, that we will be one of the most innovative small nations in the world by 2033. I believe in Scotland that we have the people. As I said before, we have the education and the industry and the assets that are necessary to make that ambition a reality. In doing so, we will take our place alongside other European countries of a similar size, such as Denmark, Norway and Finland, where innovation is a core driver of their national economies. And we will do this by focusing on our existing strengths, our growth sectors, which I've already mentioned: advanced manufacturing, energy transition, data and digital technologies, and health and life sciences. And we will support them through that sustained effort I spoke about and the transformational programmes. So at the start of my remarks, I said that collaboration is at the heart of innovation. We can only achieve innovation through greater collaboration. So only by working together can Scotland's diverse innovation ecosystem truly become more the sum of its parts. And many of you attending today will have a role to play in delivering the aims of the innovation strategy, providing sustainable growth and prosperity to all the people of Scotland. And I know you will rise to that challenge. I know we're all very excited about this agenda, and I look forward to working with you all in the times ahead. Thank you so much for your time today. I hope the rest of the event brings robust discussion, and I'm sure the projects which Carrie will shortly describe will showcase the best of collaborative working and innovative thinking that's taking place in Scotland.
So if we move on next to Carrie, I'll stop sharing, Carrie, and if you can begin to share yours.
Always that uncomfortable moment as you see yourself on the screen as you're sharing there, Lee. But I'll put this on now. No, I've not done it. So here we go. So let me know that you can hear me, that you can see the slideshow there.
Yeah, we can see it fine, Carrie, and hear yourself, so you're good to go.
Great. So hopefully the connection will also be just a little bit better than the video. It's looking pretty grim here too, actually, in Glasgow. But thanks very much for that introduction there from the Minister. So I've been asked to join today's webinar to focus the discussion on how the Chief Scientist Office, or CSO, can support the strategy in the area of health. So a bit of a whistle-stop tour through the NHS innovation infrastructure, some of the activity, and finishing up with a couple of live examples. So we'll be looking at the Reducing Drug Death partnership with the Office for Life Science, and also the Skin Cancer AI Challenge. So that's one piece of the jigsaw in the bigger picture of the digital dermatology service redesign. So a couple of quite different examples, and I hope that gives a bit of a taste, a bit of a flavour of the work underway in CSO. I'm conscious that there have been presentations before in this series of webinars with people from within the ecosystem and from my colleagues, but today will be a little bit more behind the scenes within the Chief Scientist Office. So the Chief Scientist Office is responsible for supporting research, development and innovation across health in Scotland. So the R&D work is well established, been running much longer, and supports all the research in NHS Scotland. There's also an extensive fellowship portfolio supporting clinical and innovation research opportunities. And the office has a number of functions around funding various research units, governing the safe havens, and ensuring access to UK and EU research programmes. But in the last few years, we've been spending our time developing the innovation and adoption portfolios to sit alongside this and complement it, of course, as I'd say, being part of the innovation team. So the mission statement from Dame Anna, the Chief Scientist for Health, is delivering innovation through research. And this is what the innovation pathway shows here. We'll talk more today around that stage 2, the early stage innovation. But to briefly touch on that adoption and beyond part, CSO support the Centre for Sustainable Delivery in the development and the delivery of the ANYA pathway. So that's the Accelerated National Innovation Adoption Pathway. That's probably a webinar in itself, but the focus of ANYA is to fast track proven innovations into the healthcare frontline on a national and once for Scotland basis. But looking at the stages that precede adoption, early stage innovation development is funded by CSO through open innovation competitions. To date, this has been based on the demand signalling plan, which identifies those key health challenges in Scotland, but where we can really have an impact as an enabler of recovery, reform and sustainability in health and social care. So what do we mean by open innovation? So when we talk about open innovation, we're really talking about that collaboration, that collaborative approach. In health, as shown here, it's the bringing together of health and social care, of course, with academia and industry, and what we describe as the triple helix model. It's that conversation and collaboration within the triple helix that holds the power of understanding where innovation is needed, what impact it can have, and what priorities we should focus on. In CSO, we use the innovation consortium model to really facilitate that conversation and launch challenges that support the development of innovative solutions, be it those from emergent products, market-ready innovation, or spin-outs, as shown here, or for the future use in a potential future use in the commercial marketplace. And to do this, I think you're probably familiar, hopefully a lot of you on the call are familiar with this infrastructure. So this is the NHS Regional Innovation Hubs funded by CSO. And it's these hubs which represent all of the health boards in NHS Scotland and support the innovation activity. We've got the north of Scotland, HISIS in the south east and the west of Scotland, and I'll put the contact details up at the end for each of those. But the hubs are really that kind of primary connection within the triple helix, really acting as the gateway between industry and the NHS. So making sure that innovative products are directly applicable to the NHS and not developed in isolation. They do that by working with the NHS teams, and they provide access to data, to healthcare settings, to patients, and the data and the healthcare settings. It's around that interaction with the relevant service pathway to really get that insight. So that provision of the testbed environment also comes with added support and expertise around some of the key issues. Some of the examples are information governance, clinical safety and regulatory standards. That really helps manage those hurdles that innovation needs to understand and overcome for solutions to be adopted in Scotland, and wider than Scotland in the UK or even internationally. Now, I won't spend long on the next couple of slides, but I've included them here so that you can access them again at a later date. I think they're going to be shared after this. Here we show what we're talking about by early stage innovation. So it runs from that clinical engagement to the clinical validation through the TRL levels, those technology readiness levels. And over the last few years, CSO has been leading the development of the National Open Innovation Approach. So this is based on the SBRI model, which is Innovate UK's small business research initiative. I put a link here on the slides, hopefully that'll work for people, but you can Google it anyway, around quite a useful animation from Innovate UK on SBRI. And I won't put you all to sleep by going through the process in each of the steps here, but what we're showing is how we move through from the identification of a priority area, launch the challenge to support it, and award contracts to successful projects. In the main, we use a two-phase model. So phase one being feasibility study and phase two being tests of concept. The development of this process or approach is constantly evolving and is done hand in hand with the innovation hubs. What it's helped to achieve is to streamline some of those work practices and provides a structured and consistent approach to connect companies with the challenge and the funding. This process can be followed at a national, a regional, or a local level. And as I said, it really provides that consistent experience for the applicants and the companies, regardless of the challenge size or location, with templates for all the key documentation. And here's a quick view of the work that's underway. The first Open Innovation Challenge was launched or the National Challenge was launched in June 2022. This looked at sustainable and accessible mental health services, so ways to address the backlog of people on waiting lists, optimize those clinical pathways, for example, through asynchronous approaches or platforms and remote monitoring. You can see here, each challenge is launched with a lead innovation hub. So they're really responsible for the program management, and the projects supported by each of the challenges can sit across any and all of the innovation hubs. I'll come to focus in a minute on a couple of these challenges, but to note the exception here is the Innovation in Menopause service, the challenge led by my colleague Suzanne Graham. This one was delivered in a partnership with Civtech. That's an accelerator programme funded by Scottish Government rather than the SBRI approach. And we're currently working at CSO together with Civtech to identify future challenge areas to run more of those partnerships. In terms of the outcomes, across the 9 challenges launched since June 2022, CSO has committed over £3 million funding and raised over £6 million additional funding. So that's working in partnership with other departments in Scottish Government, such as Civtech, and the UK government. So a large part of this additional funding has come through the healthcare missions launched by UK Gov through their Life Sciences vision. And that actually takes us to the first example of work underway, which is largely funded through the UK Addiction Healthcare Mission. So the aims of the UK addiction mission really closely align with those of CSO. So firstly, they want to help develop that research ecosystem in addiction. And the second kind of ambition is around funding and stimulating innovation opportunities in drug use and addiction. In the case of this challenge, it was really specifically around reducing drug deaths. And this work really supports the Scotland's national mission on drugs. So that highlights that drug death emergency is a key priority area for innovation in Scotland. CSO were able to respond to that by including this as a target area in our demand signalling. And the reason being is that drug use and the associated risk of harm and death is exceptionally high in Scotland. The stats here are from the latest stats of 2022. Where in that year they saw a significant decrease in the number of drug-related deaths by 21%. But still, Scotland has the highest rate per population in the UK and Europe. We'll get the latest stats in 2023, but early indication shows that the reduction is not likely, that we saw here in 2022 is not likely to be repeated or even maintained. CSO, looking back at that process approach that I showed earlier, we were already underway with this work. We'd already set up the Innovation Consortium for reducing drug deaths, and we're working on a challenge in this area. But then we made the connection with the Addiction Mission, and co-funding from the Office for Life Science really increased the reach of the challenge to all 4 nations, and increased the funds substantially from £500,000 to over 5 million now. So we use that national open innovation approach. CSO have led the challenge with NHS Fife providing invaluable support through the innovation team, which is part of the HISIS Innovation Hub. As you can see here, the challenge statement focused on detection, response, and intervention in potentially fatal drug overdose episodes. And then what this, having those 3 elements really brought an exciting mix of projects as companies could focus on one or more of those. It was also a key priority within the challenge for solutions to be user-focused and user-friendly. So include a co-design element using the expertise of people with lived experience, people who use drugs and their families in the development of the solutions. And I'll touch on that a bit in a minute. So at the end of summer last year, we awarded 12 contracts that are shown here in blue, in red. Get my colours right. Each of these projects is supported by a testbed partner to help the company develop and deliver their solution, which is shown in blue. So in Scotland, those testbeds are via the innovation hubs, as I've described, and then similar agencies that work in the rest of the UK, such as the health innovation networks. So as you can see here, the competition has really succeeded in that UK-wide reach. The contracts in phase 1 were for £100,000, and that's just come to an end. And now we're running the application and evaluation process for companies to move into phase 2, where they'll be able to access up to £500,000 per company. The contract for phase 2 covers the development, testing, and validation of a solution or prototype for up to 12 months. But looking across the projects that are in phase 1, 7 of the projects focused on detection and response. In the main, they were wearable devices, looking at things like respiratory rate and heart rate, motion and voice, and linked out to an alert function. And the rest focused on intervention, looking at the therapeutics, so the antidotes used in overdose episodes and the delivery and administration of those therapeutics. So to give you, I won't go through all of them, Don't worry, but to give you a flavour of some of the projects supported, these 4 shown here are the Scottish-based companies and projects. The West of Scotland on the left here is supporting 2 of the projects, developing wearable devices, and HISIS supporting another project working with eMoody based in Edinburgh. That's also a wearable device, but has with also an alert function as well, and includes a machine learning element looking at the digital behavioral markers, such as like using your phone or apps, as well as the physical ones, such as respiratory rate. And finally, on this one, we have Pneumawave working with the Health Innovation Network in South London, but also at the University of Dundee. A further 4 projects are working directly with Scottish-based testbeds. So HISIS, through the NHS Fife team, are working with another 2 companies based in England. Here, like to look at MESOC's project that's based in Leicester, is the Rescue Patch. That's a skin patch, a transdermal patch with a controlled release of a combination of antidotes for both opioid and benzodiazepine overdose, which specifically reflects the common use of both of those in combination in Scotland. The Scottish Ambulance Service is working with the Welsh Ambulance Service to support an app development to build a network for naloxone community responders and offer some training. And on this one, Manchester Met is working with the Queen's University in Northern Ireland and Salvation Army in Scotland to access participants. So 8 of the 12 projects have an affiliation with Scotland, which from the CSO point of view, we're extremely pleased to support, and goes to support some of those points in the innovation strategy around making Scotland one of the powerful and innovative of the small nations. The final 4 of the 12 projects are working with English testbeds. So, for example, the AHSNs, or I think the rebranded now as the Health Innovation Networks. These ones include a couple of interesting projects as well around intervention with, for example, the drone Mat Lab is the rapid deployment of naloxone nasal spray via drone. They've just completed their technical and commercial feasibility study on that. And King's College London is looking at a more portable format of naloxone, which could really encourage people to carry a dose with them at all times, which would be great. So that's all 12 projects of the Reducing Drug Death Challenge that we've supported in through phase 1. One of the really exciting elements of it, though, is around the level of co-design that's been included through the test beds, linking with people that have experience of using drugs, people with experience of drug overdoses, or having experience of being the first responder to an overdose alert or a call. Projects have also included some of the usability tests. So, for example, what is it actually like to wear some of these wearable devices? I look forward to being able to update you on some of that as we move through phase 2. So to round off with a second example of work underway, this time it's supported by NHS Forth Valley Innovation Team, part of the West of Scotland Innovation Hub. You see, it's quite a different topic area and challenge design. So this is supporting 25 by 25, which is the aim of the AI Skin Cancer Consortium to support the rapid diagnosis of skin cancer in 25 minutes by 2025. The consortium is working with CSO and Anya, the pathway that I described earlier, to develop that Once for Scotland digital dermatology pathway. A key component of this, the potential to have the key component, is to use machine learning to achieve that ambition. So touching on the kind of stats behind it, why is this a priority for innovation? In the UK, dermatology services receive over 1 million referrals a year. Now, 60% of these are suspected skin cancer referrals. However, only about 6% of those referrals are converted to confirmed cases of skin cancer. So in the digital dermatology pathway redesign, the focus is on increasing the number of referrals that are accompanied by a high quality image to 90%, as you can see here. That, with the image included in the referral, should reduce the demand for outpatient appointments and reroute that clinician time to other parts of the pathway. And you can see here as well about the dermatology outpatient waiting list numbers for NHS Scotland alone is now over the 50,000 mark. So if we can increase the number of high quality images as part of that referral process, it also opens the opportunity to different triage methods. In this open innovation competition or challenge, what we were doing was testing the potential of AI to accelerate, to assist the triage by training algorithms to distinguish between common benign lesions and those from, be able to distinguish, between the benign skin lesions from cancerous ones. So along the bottom here describes how. So images are captured in the CLIC, that's the Community Locality Image Centre, the first of which is opened in NHS Tayside. Currently, patients are referred there after the consultant has triaged an image and wants to see a clearer or dermoscopic image. And this is where the innovation challenge comes in. So running alongside that existing pathway, three of the three awarded companies that are shown here will have access to those real world images in a trusted research environment, the HIC, to test and refine those AI algorithms to identify cancerous and benign lesions and to automate and speed up that triage process. So the ambition is that the solution will be able to plug into that wider service change for the digital dermatology pathway and to accelerate the triage and diagnosis of skin cancer. But before I put a caveat in before my procurement colleagues tell me off, is that all of the things that I've described today are in the open innovation process is all pre-commercial procurement. And any of the solutions that are then used in service delivery by the NHS would need to undergo a commercial procurement process. So that's it from me, a quick zoom through the world of CSO innovation and a couple of examples there. And probably, I imagine I've said innovation about 400 times. So the contact details are on the screen here, both for my team in CSO and for the innovation hubs. And you can contact them on anything that we've covered here today or learn more about any of the 9 challenge areas currently underway. Lovely, thank you.
Fantastic, Carrie. That was really informative. Lots of information there. I'm sure there'll be a few questions, but I'll let you catch your breath and pop over back to my slides. Jane, have you been managing to grab some of those questions so we can direct them to Carrie? Right. And I think Carrie...
Sorry, carry on.
No, on you go.
Yeah, we've had a few in, so I'll see what we can get through before we finish up at 12:45. And as we said, if anyone has any more questions or theirs doesn't get answered today, you're welcome to get in touch with us directly and we can pass our question on to the relevant person to answer. So I'll just get started. The first one we have is for you, Carrie. It is, how do you see digital solutions evolving in future for improved healthcare delivery, and what do you think their impact will mean for innovation?
Sorry, can you say it again? I'm just distracted. I can just see myself on the screen. Is that what it's meant to look like?
Oh, sorry, you're sharing your screen still, yeah. There we go.
Phew, that's better.
Sorry, so it's how do you see digital solutions evolving in future for improved healthcare delivery, and what do you think their impact will mean for innovation?
Well, I think, to be honest, that's probably exactly what I've just described. A core component of the work that is underway in the Chief Scientist Office is based on the digital approach. So across the different challenge areas that we've identified, the challenge descriptions themselves often support that role of the digital technology in taking this forward in terms of that like healthcare change. So really it's just intrinsic in everything that we do, and across all of the approaches that we have.
Great, thank you. Another one we have is, to your mind, are there any particular areas of digital growth that should be focused on? Are there any quick wins?
Well, I wish if there were, we'd definitely be pursuing them. So I think, as I finished up there in the presentation, around the Skin Cancer AI Challenge, the fact that we're able to consider multiple areas of a service pathway has the real power there. It's not a quick win, but if you're continually looking at all of the elements and trying to move them forward rather than just focusing on a single point of a single change, then I think that has the power to make the biggest change. In terms of areas for digital innovation, obviously the DHI, the Digital Health and Care Innovation Centre, that's their absolute kind of power unit of what their ambition is. There are like so many that you could really bring this approach to all areas of the NHS and social care. And whilst we've been able to identify some of those priority areas that we're working on so far through the demand signalling plan, that's not to say that I can't do a slide of why is this a priority on almost everything. You know, the reform and recovery of the NHS is needed across the board. And so you could really make a case in multiple areas for this.
Yeah. Thank you for answering that one.
I don't know from InnoScot Health point of view, in terms of those priority areas, as I mentioned, that we've got the demand signalling plan, which we're looking to kind of refresh and support that NHS reform and recovery. But from InnoScot Health point of view, I don't know if you have also identified specific priority areas for digital innovation.
Yeah, thanks, Carrie. I think that's something, like you say, that DHI, we work quite closely with them and looking at overall priorities. There are some specific areas which, like you say, it's a broad church, the recovery of NHS, but we have certain calls within InnoScot Health, which you can get further details of in our website, and certainly, yeah, that's something that we expand on every year. You look at different priorities every year, and then have those specific calls, and there'll be further details of those on our website quite soon.
Yeah, great, thank you. Another one that we have had in is, Carrie, do you think we need to embed a more digitally skilled workforce in order to encourage innovation in that area?
An excellent point. I think everything that we do needs to be supported and empowered via the workforce, and this probably really touches on, or for me it brings to mind, the other role that I have, in that today was presenting really from that CSO perspective in my role as part of the CSO innovation team, but I also have the portfolio lead for Digital Lifelines Scotland. And even in just that one example, which is around kind of digital inclusion for people who use drugs, the power of the workforce within enabling that change and access for people is absolutely intrinsic. So to be able to kind of develop the workforce to not just have the skills and knowledge, but it's also the confidence to feel like they've got the skills and knowledge around digital skills, to be able to then use technologies and innovations in their area of work, in service redesign, in their engagement with their patients or service users. So yes, very much so in terms of the power of the workforce behind this change.
Great, thank you. So another one we have is, I work in local authority within the council and have an idea for a collaborative project with the NHS. who should I approach about this?
So I think, I don't know if you can access the chat and put up the details, but really the front door for those ideas is through Scotland Innovates. So that's a website, a service run via, I think it's probably funded via a Scottish government, run through NSS. And it really offers the opportunity for people to register their idea, talk to somebody around the opportunities for development, but also to be able to access resources and support to support that ongoing development. So there's loads of other case studies on there. There's loads of information around some of those issues that I talked about, such as regulatory approval or information governance. There's resources on there as well to be able to support that. I would say that that's our kind of front door for those suggestions to come in. I did also include the Innovation Hub addresses. So if somebody's based in a specific area, then they can access the innovation team for their health board or their region via those innovation hubs.
Yeah, and just to say, in terms of the Innovation Hub's details, it's on the Anya Pathway leaflet, but you can also reach out to InnoScot Health, one of the innovation team, if you have any specific questions or queries. And if it's appropriate, then we can refer you or let you know about the details of the specific innovation hubs that we work with within the NHS. I think, unless there's any more questions, Jane, that we're getting to the end of our time.
I think, sorry, just on that, I don't know, also, but perhaps something that we can share after is around, we're trying to improve the way that we communicate about some of these opportunities. So people might have ideas that they're like sitting on or contemplating what to do, but they might fit with the challenges, both that are published via InnoScot Health, but also that are published through CSO and the Innovation Hub. So CSO have got a newsletter that highlights not only our funding areas, but other funding and grant opportunities. So I'd suggest signing up to that as well.
Thanks, Carrie. That's fantastic.
Yeah, I think my colleague Simon has popped in some more information about Scotland Innovates as well for anyone that's looking for that. So yeah, I'll wrap up the questions there and I'll pass back to you, Leah, to wrap us up.
Thanks so much, Jane. I think the next slide is just around the next webinar, which is planned for February, and it looks like a interesting topic, and it's maximising NHS Scotland's end-to-end innovation resources to improve healthcare. There'll be more details about that under our events section at the InnoScot Health's website, and then you can register there as normal. So thank you for attending today. Thanks for your time. Hopefully it's been a useful subject and interesting for you, and please do register for our next webinar. Thanks very much.